Arthroscopy of the hip involves a procedure where we are able to distract the hip joint and introduce a camera into the joint that allows us to look at the condition of the hip and often to treat some of the abnormalities that have occurred. So the hip joint, depending on its shape, is rather prone to certain injuries, in particular the cartilage rim called the labrum. And it's not unusual for patients to develop pain in the region of the groin that they put down to a muscle strain or something like that, that actually turns out to be a problem with the joint itself. And usually the first thing that gets injured is the labrum, and we often find that there's a specific underlying abnormality of the shape of the hip that has predisposed the hip to developing pain. There are a number of conditions that we can treat with hip arthroscopy. Mostly, as I've said, it's often an injury to the cartilage rim, but there are other aspects that can be quite abnormal. In particular, we can deal with some loose bodies if they've started to catch or cause problems in the hip joint. Sometimes the abnormality relates to the shape of the hip socket that we call the acetabulum, where that can lead to an impingement problem in the hip. Sometimes the initiating abnormality of the joint relates to the shape of the ball bit, the femoral head, which is not completely round, and this leads to issues developing in the joint. There are other less common aspects that can develop, sometimes related to the soft tissues around the hip, the tendons or the capsule, and so there are a variety of structures that we can treat using this particular technique. The advantage of a hip arthroscopy is that this is a minimally invasive technique that allows us to access the hip joint through usually 2 or sometimes 3 small incisions. And this makes the recovery from surgery that we do to the hip much quicker than when we did previous bigger open procedures. But it's important that we still continue to treat the underlying abnormality of the joint even though we're doing it through a small incision. And it's important that we're still able to do what we did through an open procedure, and modern approaches to hip arthroscopy have allowed us to do that. So the surgery, when we come to do a hip arthroscopy, the surgery does involve a patient having a general anaesthetic. In order for us to be able to actually look inside the hip joint, we have to be able to distract the joint. That means we have to be able to pull on the leg and actually distract the femoral head from the socket, otherwise known as the acetabulum. That allows us to gain access to the central part of the hip and deal with any of the cartilage problems that we see associated with the conditions that we treat. We then have to allow the hip to go back into its socket, and we're also able to treat conditions around the femoral head and the femoral neck that often have led to the problem arising in the hip joint in the first place. I think it's helpful just to look at some images, and we use some 3D CT techniques that allow us to model how the hip behaves and why the hips become abnormal. And with the CT technique we can demonstrate where the femoral head has become aspherical, that's where it's not round, and by modeling with some dynamic images we can actually see where the hip is impinging on the socket and causing the cartilage rim damage. And with that information, it helps us with the surgical planning of what we need to achieve when we're doing the arthroscopic procedure. After a hip arthroscopy, the sort of outcome that one can expect will depend a lot on the kind of activities one's been doing before, and will depend a lot on the level of damage that has occurred to the hip joint as a result of the injury process. So mostly the kinds of patients we're seeing are patients who are active in sport and exercise and are troubled by recurrent groin pain that have stopped them being able to continue their exercise activity. Now, when we're able to intervene and correct the injury that's occurred to the hip, provided that there isn't too much damage to the joint already, then we're very successful in being able to improve patients' symptoms and allowing them to return to sport. I think it's important to emphasize that even though we're doing this through a minimally invasive approach, it's still quite a lot of surgery to the hip joint itself. So the hip joint itself does take some time to recover, and we usually tell patients that return to sport is around 4 to 6 months before they're resuming what they were doing before. recovery is very much a rehabilitation program involving low impact exercise to get them back to the activities that they were previously doing. Unfortunately, we do see patients who've already developed significant damage to the hip that effectively is early osteoarthritis. And unfortunately, these sorts of interventions aren't very effective once the joint itself has started to develop arthritic changes. So we're very keen that people are aware, particularly physiotherapists and treating doctors, that when people start to complain of groin pain, that they're aware that this could be a hip condition that needs to be assessed and then treated properly. In terms of the longer term outcome, what we don't know is if these patients will, for instance, escape the development of osteoarthritis in the future. And we do know that some patients probably will go on and get arthritis in the future and may end up, for instance, requiring a hip replacement. So we don't know at the present time whether the surgery we're currently doing will make a difference to the longer term outcome in terms of osteoarthritis and the need for a hip replacement. But what we do know, and what we do have good evidence on, is that we're quite good at improving symptoms and return to activities and sport.